بسم الله الرحمن الرحيم.
Beginning by the name of Allah, who is the most merciful and kind. This is a Smart tool from British Institute. This channel is based on knowledge. You are kindly requested to like, share and subscribe our channel. Thank you.
Dear viewers, today we are going to discuss about what is gastritis, what are the signs and symptoms of gastritis, what causes gastritis, how do you know if you have gastritis, what is the treatment for gastritis, is there a diet for gastritis, what home remedies help reduce symptoms of gastritis, how long does it take for gastritis to go away, can gastritis be cured, how can you prevent gastritis? Very cheap medications for gastritis.
What is gastritis? Gastritis is aggravation of the coating of the stomach. Sadly, the expression gastritis has been abused to incorporate a wide range of upper stomach issues. However, obvious gastritis alludes to the stomach lining, gastric mucosa, that is aggravated. All or a piece of the gastric mucosa might be included. Gastritis might be delegated intense or constant. Intense gastritis, possibly described as erosive, harmed regions where mucosal cells are disturbed or absent, and non-erosive. Ongoing gastritis is dictated by histopathology, appearance of the gastric mucosa, with side effects enduring quite a while. There is no generally acknowledged grouping framework, albeit some have been proposed. This data will zero in on obvious gastritis. Gastritis has numerous causes, yet most causes bring about comparable indications. This has prompted some disarray and is the motivation behind why numerous medical care experts presently think about the expression gastritis as a vague depiction of a group of side effects. There are two types of gastritis, acute and chronic.
What are the signs and symptoms of gastritis? Some people with gastritis might not have any symptoms, but each acute and gastritis might have symptoms and signs of abdominal pain, nausea, vomiting, and infrequently, benching, bloating, loss of appetite, heartburn and stomach upset, etc.
How do you know if you have gastritis? Gastritis may be diagnosed by your symptoms and history, for example, non-steroidal anti-inflammatory drug and/or alcohol consumption, or by breath, blood, stool, immunologic, and diagnostic assay tests to observe H. pylori, and alternative tests like examination or radiologic studies demonstrate tissue layer changes.
What is the treatment for gastritis? The treatment for gastritis varies according to the cause. Alternative less common causes could also be treated equally, however don't treat the underlying cause.
Is there a diet for gastritis? Gastritis symptoms are often worsened by chemical irritants that cause or aggravate the symptoms of rubor, ought to be reduced or stopped altogether. For instance, stop smoking cigarettes, avoid drinking excessive amounts of alcohol, avoid caffeinated, decaffeinated, and effervescent drinks, and fruit juices that contain acid, for instance, grapefruit, orange, pineapple, etc., and avoid high-fat foods. There is no rubor diet, however, the expansion of H. pylori could also be stopped by a diet wealthy in fiber, and foods that contain flavonoids, for instance, shorties, onions, garlic, berries, celery, kale, broccoli, parsley, thyme, foods with soy, and legumes, for instance, lentils, kidney, black, soy, pinto, and navy beans.
What home remedies help reduce symptoms of gastritis? Home cures may help decrease gastritis indications, however for the most part don't treat the fundamental reason for the condition. How long does it take for gastritis to go away? Individuals with intense gastritis ordinarily recuperate totally without any inconveniences. Be that as it may, ongoing gastritis may have a scope of results from great, early treatment, to poor if genuine intricacies create. Infrequently, entanglements can happen from intense gastritis. Confusions from constant gastritis incorporate peptic ulcers, draining ulcers, frailty, gastric diseases, malt lymphoma, renal issues, injuries, inside block, or even demise. In the event that fundamental reasons for gastritis, for instance, liquor, or NSAIDs utilization, are dealt with or not utilized, gastritis likewise might be forestalled. Can gastritis be cured? Gastritis might be relieved if the fundamental causes is restored. How can you prevent gastritis? Since gastritis is a disease, and would you be able to stay away from it by rehearsing great hand washing strategies, for instance, wash the hands completely and often. To diminish the danger of gastritis, keep away from circumstances where you are presented to synthetic compounds, radiation, or poisons.
Cheap and effective medicines for gastritis. There are so many medications for gastritis, like cap ruling 40 mg, omeprazole cap SO 40 mg, esomeprazole cap contour 40 mg, esomeprazole capsules ruling and SO etc. are very expensive, and I would recommend you to use contour as this one very cheapest and very effective. Contour 40 mg 1 capsule daily before breakfast.
Gastritis with H. pylori. A bacterium called Helicobacter pylori or H. pylori can causes you gastritis. Then use tablet Claritec 500 mg with twice a day after meal, along with cap contour 40 mg, esomeprazole.
We hope that you have learned a lot from this video. If yes, kindly like, share, and subscribe with comment. Do not forget pressing the bell icon so that you get notification of coming videos. Thank you and Allah Hafiz.